Now let's solve the challenging case 128. Now I am checking the direct pupil reflex of the right eye, and you can appreciate that it is mid-dilated, non-reactive. There is a subconjunctival hemorrhage on the lateral bulbar conjunctiva and a large wound on the right brow and forehead. There is also a small wound on the left forehead eyebrow as well. Now when I put the light in the left pupil, it constricts, means that the direct light reflex of the left eye is intact and consensual light reflex of the right eye is also intact. When I do the swinging flashlight and put light in the right pupil, both pupil dilate. Now that confirms the positive right RAPD or relative afferent pupillary defect. Now this 16 years old male patient presented with marked decrease of vision after trauma. He had road traffic accident, fell from bike, and now presented with perception of light, positive vision in the right eye and 6/6 in the left eye. Trauma was few days back. So diagnosis of this challenging case 128 is right traumatic optic neuropathy with perception of light, positive movement, positive relative afferent pupillary defect, mid-dilated, non-reactive on direct reflex, the right pupil. A fundus is normal, healthy optic disc, as the injury is of recent onset. With time, optic atrophy will occur. Now patient is put on oral steroids by other ophthalmologist. Ideally, we should start IV methylprednisolone followed by oral, as we do in optic neuritis. But studies results are inconclusive. Surgery is also not very successful. So with such brisk RAPD and marked visual reduction, prognosis for visual recovery in this patient is very poor. So take home message is that we should care while driving bikes. We can not only injure ourselves but injure others. And look at this young 16 years old male patient. Now his fundus is absolutely fine, but his vision is lost irreversibly. Thank you very much.